Hi, hello, welcome. Thank you for watching this video. This is Nurse Choma, founder of Choosing Nursing. I am going to be talking with you today about 3 important updates about the Nclex exam. So if you are interested in this subject, then I highly encourage you to watch this video all the way until the very end. This is your first time hearing from me, go ahead and hit the follow button. I promise you I'll give you great information. We're actually doing something really special today. Actually, not even today. It's going to be starting tomorrow. So if this is your first time, if you've been trying to pass your exam, if you've been uncertain as far as like what steps you need to take, that kind of stuff, then you're in the right place. All right, so I'm going to go ahead and give you a minute to join. Go ahead and comment below, say hello, let me know where you're watching from tonight. If you are new, let me know that you're new, and we'll get started in about a couple of minutes. All right, we're gonna start in a couple of minutes. Okay. All right, so comment below. I don't see any comments yet, so I want to make sure that you can see me and everything. Hello, there we go. Hi, hi, hi. Welcome. Thank you for being here. Let me know. Hello, welcome. Hello, good morning. Good morning. Good morning. Welcome. Comment and let me know where you're tuning in from. Hello. Hello, hello. I don't have my glasses on or my contacts on right now, so I may not see your name very well, just to be honest. Happy New Year. Happy New Year, or your comments very well, but it's still good though. Let me see. Okay. All right, Happy New Year. Oh, here we go. There we go. Okay, good. All right, so come on in this morning. We're going to be, so like I was saying earlier, is that we're doing a special challenge. It's called our New Year, New License Challenge. And the purpose of this challenge is to encourage you to pass your exam this year in 2019. So it's going to be kicking off tomorrow. You need to join the challenge. Thank you so much. You need to join the challenge in order to be a part of it. It's going to be awesome. This morning, I've already sent out a couple of the handouts and the lesson plan via email. So I sent out 3 things this morning. I emailed you the agenda, so meaning what we're going to cover every single day of the challenge. It also has the times that we're going to be coming up live, and then I also emailed you the what's the other one? It's called a study plan tracker. So the what this is, the study plan tracker is to help you be accountable. So pretty much what's on it, there's some numbers on there. And so pretty much what you're going to do is that every time you study, or sorry, let me say it like this. You're going to count how many times you study that day. So, and I'm going to explain this tomorrow in more detail as far as what is the patho level, what is the content level, what is the nursing level and strategies, if you're not already familiar with what that means. But I'm going to talk about it. I will talk about it in more detail tomorrow for sure. But pretty much though, the patho, the content, and I think I need to have you take the test actually. So I'm going to talk about it in more detail, what each of the level means: patho level, content level, nursing level, and strategies level. And so you're going to pretty much be tracking how many times you study that day. It's so you can be accountable. And then on top of that, you're also going to receive a lesson plan each day of the challenge. So every single day that we meet, you're going to download the plan. If you can print it out, that'd be great. But download it, and so you're going to print it out and everything, so that way you can write down and take notes from what I go over during the live video. All right, so there's 3 documents that you received via email if you have already joined the challenge. If you have not yet joined the challenge and you want to receive everything, because we're going to do live videos, we're also going to do like homework, like I have homework and everything. And then on top of that, we're also going to be giving away a giveaway prize at the end. So to join the challenge, type just one word here in the comments, Nclex. Nclex, all right? Type the word Nclex in the comments. And if you have Facebook Messenger, I will email you I'll message you the link to join the challenge for free. If you don't have the Facebook Messenger, then go to BIT. All right, go to BIT. Let me put it on here. BIT. Okay. bit.ly/choosing nursing challenge. Okay. All right. I'll put that there. Join challenge. Let me put it like that. Let me see if I can just spell it. I'm just put it in the comments. And type Nclex or go to this link. All right, and let me pin this too. That's better. Okay, all right, so yes, so it's gonna be exciting. It's gonna be a lot of fun. It's gonna be a lot of fun, I promise you. Last time we did it, it was so much fun, and we had, like, I was crying. I was crying because it was fun, and I was like crying and everything, and every people were crying. It was such an amazing experience. So definitely join the challenge. You have to join the challenge to get all the notification. You need to also be active by, coming on live, sharing the videos, liking the videos, commenting, saying hello, especially with the images. We're going to be posting images for the challenge every single day. So you want to interact. At the end, we're going to pick a random winner who's going to receive the giveaway prize. All right, so definitely be a part of the challenge. Okay, you can still get the promotion if you were trying. You may need to use, I'm going to put the information right here for you. I should have put it on here. If you want to get the promotion, go to this link here. All right, try this link. And then you need to put the word all together for it to work. Otherwise, it won't work. That might be the reason why. Let me put it really quickly. The bundle. And use code new year. Okay, all right, there you go. That's it right there. If you want to use if you want to get the whole cheat sheet bundle and everything. Okay, so let's get started. All right, we're going to talk about 3 important updates about the Nclex exam for 2019. You want to know what this is? This is so important. If you are ready for this information today, comment below ready. Ready. Let's talk about this. If you are ready to learn what are the important updates that you need to know, what I'm going to be covering, the focus for this is going to be both the RN and the LPN exam. So if you want to know what this is, put ready in the comments, like this video, heart up the video, share this video so other people can know this information. We get so many people from all over the world, people who have, it's been a long time, people who since they graduated, people that recently graduated. So this is really important for you to be familiar with. Let me pull up my notes. Okay, all right, ready? Yeah, you can watch the replay later. All right, so okay, good. I see plenty of readies. All right, I see plenty of readies. So here's the thing I want you to understand. All right, so let me get started from this angle. And if somebody could put this in the notes, I would really appreciate it. Or sorry, in the comments, I would really appreciate it too. And you're getting extra points when you do that. So, all right. So, anyways, though, so let's talk about this. The thing that you have to realize is that the Nclex is always adapting to the way that things are in the clinical field. Okay, let me say that one more time. The Nclex is always adapting based on how things are clinically in the clinical field. So, because here's the way that in fact, the way that the exam was actually created is that they pretty much interviewed nurses, right? This is how they generated the questions on the exam. They interview nurses in different hospital settings, and they identify what are the most common scenarios that they encounter. And then they use that to create the exam. Okay? So the biggest thing you have to understand is that the NCLEX is always adapting to based on how things are clinically in the clinical field. So if you, and that's why the test gets harder the longer it's been since you finished nursing school, because you lose clinical skills. It's not even the fact that the test itself is getting more difficult, but it's really because the time between when you graduated and now you don't have the same clinical skills. So that's why it's more of a challenge as far as really understanding what the questions are asking you. And this is why one thing I really recommend is that if it's been several years since you finished school, if you can put yourself in a position where you can get more exposure to the hospital setting, whether that's like if you're really serious like this, I would say if you're 10 plus years, if it's been like 5 to 10 years since you finished nursing school, I would recommend that you start volunteering at a hospital. You do something, or you maybe go for like a day or something, and just expose yourself to the hospital field, because it's really all about your ability to grasp and really understand what's going on clinically. Because there's some things, honestly, that you're not gonna get from a book. I'm just telling you the truth right now. There's some things where you're really not gonna get it from a book. That's why there's people that are book smart when it comes to nursing, and then there's people that are more clinically hands-on. And honestly, if I would say if there was one that was more important than the other, I would say it would be the clinical side, because the clinical side you can actually save a life. The book side, you're still waiting to think about what to do next, because you need to think about what you read in your book. So the first one is to understand that the exam is always adapting based on how things are clinically. Okay. Now the first thing I want you to know, all right, the exam, it does change every 3 years. Actually, let me say it like this: every 3 years, the boards of nursing, right, they come together, and that's when they decide if they're going to make changes to the test. Okay? If they're going to make changes. But honestly, the changes that they're making is that they're determining whether or not they want to make it a little bit harder to pass the exam. Not necessarily where they change the entire makeup of the test. Let me explain what I mean by this. All right? So usually they'll change it by like a specific let's say for example, that in order for you to pass the exam, you need to get this is not anywhere what it is. I'm just giving you an example. Let's say, for example, in order to pass the exam, you need to get an 82%. All right? You need to get an 82%. So you need to get that 82% in order to pass the test, right? But so what they do is that they'll converse as far as if they want to change it, where now instead of it being 82%, it's 84%. You see that? So it's not where like it's a huge rise, but it does matter if you are somebody where you keep getting that near passing standard. Then it's gonna be those points are really gonna matter. But overall, it's not going to be that big of a fact. So don't be so concerned about the changes that they do every 3 years. As far as like by April, usually those changes go into effect by April, where they're out, and I'll talk about what they are specifically. but usually it goes into effect by April as far as them adapting the percentage. So I remember when I personally was in nursing school, and it was towards the end of our time, they told, like, it was when I graduated. I graduated in May. I graduated in May, and they told us that the test was going to be changing in April. So we were still in nursing school. And so when they told us this, they said that it was going to change by like negative 0.08% or something. So something that was very minimum. And I remember, though, a lot of people were panicking and freaking out because we were thinking that it's going to be so dramatic and so drastic, but it wasn't really anything different. It was honestly just the fact that they were adapting as far as like the percentage, which was like nothing. Now, however, though, the exam does change as far as the questions and the format. So that's what I'm going to talk about next. So number one, here's the first thing was the exam gets more difficult between the year you graduated and the year that you take it. Not necessarily because the test is getting harder, but because you're probably losing clinical skills because it's been a while since you finished nursing school. So you should make it a priority, or you should, if you're really serious, go volunteer at the hospital. Get yourself some exposure, or just if you can't do that, start watching more Untold Search of the ER. Start watching more, clinical type of hands-on exposure as far as like in the like on TV, like real world stuff though, not like Grey's Anatomy. Grey's Anatomy, the doctors do everything, the nurses do nothing. I'm like, that's not really how it is. Like, but shows that really show you the in-depth side of what the nurses have to deal with and do on a daily basis. All right, here's the second thing. Number two, the format of the reason why the exam gets here's the reason why as well. The format of the questions becomes more difficult in order to match the comorbidities, the increasing comorbidities of real patients. Let me say that one more time. The format of the questions. So this is something that they will adjust in between the years, even if it's not every 3 years. They did this, I believe. So in 2015, in January in 2015, that's the year where they changed the Canadian test from the CRNE exam to the Nclex exam. All right, so it was in I remember it to this day. It was in 2015 where they took the Canadian test from the Canadian exam, which is called the CRNE, and they changed it to the Nclex exam. And unfortunately, what happened because it was such a dramatic change, there was like a dramatic increase in Canadian students not getting licensed. And the thing about it, it's unfair because here's the thing. Number two, like I said, the format of the questions becomes more difficult to match the increasing comorbidities of patients here. So the problem with that for Canadian students is that in Canada, the healthcare is better, honestly. In Canada, people are not as sick as we are here in the United States, unfortunately, because we have a lot of, fast food and that kind of stuff. But in Canada, they have great health care. In Canada, the patients are not as sick. People don't have multiple problems like we do here in the United States. In the United States, somebody can have diabetes, AFib, stroke, a history of stroke, COPD, hypertension, and also maybe like hyperlipidemia. But that's not as significant though in Canada. And so and on top of that, in Canada, the metric system is not the same. When you go through nurses, the metric system is not the same. Metric system is not the same as it is here. So there's so many different types of adjustments that the Canadian student had to make in order to try and pass this exam. That's why it's so difficult. And on top of that, in Canada, when you go through the nursing program, it's not the same as far as there's not as much as an emphasis on the on pathophysiology. And so unfortunately the test, the NCLEX, there is. see, the CRNE exam was a lot more easier than the Nclex exam. And so that's the reason why, as a Canadian student, what I would recommend is that you want to start learning how things are different here in the United States, so that way you can be successful. All right. So the format of the questions will always adapt to match the way that the like how sick patients are here in the United States. Because, okay, so let me explain this to you. This is why they changed SATA questions. This is why they changed select all apply questions recently. I want to say it was last year when they made the changes with the SATA questions. So here's the thing about SATA questions, because a lot of times people look at select all apply questions as being difficult because it's all about critical thinking, right? So it's all about thinking like a nurse, thinking hard, that kind of stuff. I'm going to tell you the truth. I'm going to give you the truth right now about SATA questions. Do you want me to tell you the truth? If you want me to tell you the truth about SATA questions, put yes in the chat box. All right, put yes in the chat box if you want me to tell you the truth about select all apply questions, because this is the reason why a lot of people pick the wrong answers, or SATA questions are so hard or so difficult. But honestly, it's because of the way that you're looking at it. It's because of the way that you are looking at it. Okay, and if you find this helpful, share this video. All right, share this video. If I missed your comments, I apologize. I'm trying to get through the information, and then plus I can't really see it very well to be honest, because I didn't put my contacts in. I forgot to put my contacts in. That's the reason why. So you have to like put in bold if you want me to see it. But okay, yes. Okay, put yes, yes, yes. And then if you missed the flash sale for the cheat sheet bundle, you can still get the cheat sheet bundle. It includes my 70 diseases guide, which is over like diseases, pharmacology, nursing procedures, rules of nines, burn patients. There's diagrams in there, ABGs. There's another one as well where it includes it's my farm cheat sheet, and that's dosage calculations, drug formulas, how to mix insulin, medication classifications, different medical terms or drug terms that you need to know, and then also labs 101. You can get the bundle by simply going to bit.ly/cheat sheet bundle and use the coupon code New Year, all one word, all together. Okay, so here's the thing that you have to realize about the questions being more difficult, about SATA questions. Select all apply questions are usually testing you on content, not critical thinking. Let me say that one more time. So put this in the chat box for me. Select all apply questions, SATA questions, are usually testing you on, it's more content focused than it is critical thinking focused. How do I know that? Let me tell you why. So, and I can't say this is all of them, but this is a majority of questions. A lot of SATA questions, when they ask you SATA questions, it will say, okay, what are the side effects of this drug? And it will list out, right, all the choices. It will ask you questions where it say, okay, what will be the appropriate nursing interventions of whatever the scenario is, right? And it will list out all these choices. It may say, okay, what are the signs and symptoms of this diagnosis, right? And it will list out all these different choices. So the reason why SATA questions usually more difficult for a lot of people is because it's really testing you on your intimacy with the content. It's really testing you on how deeply you understand the content. That's why people don't like them, because it's going to say, okay, you have a patient that's diabetic and they have type 2 diabetes, and upon assessment, you check they have not had their insulin. Which of the following signs and symptoms would you anticipate the nurse to see? Select all that apply. And then all the choices are like what? Shakiness, they're diaphoretic, they're very thirsty, they're very hungry. You have to pick all of that, pick the correct ones. So it's not really about thinking critically. You have to just know what are the signs and symptoms of somebody that's experiencing, that hasn't had the insulin, hyperglycemia. So it's not quite all about critical thinking. It's more so about your ability to recognize the content. And that's why yesterday I said that you need to pay attention to differentiating factors. When you learn something, don't just learn what it is, but see how it's different from something else. That's why people confuse, like for example, people confuse COPD with ARDS when they're two different things. People will confuse hypothyroidism with hyperthyroidism when they're not the same thing. That's why your critical thinking should start at the content, not when you do questions. If you're waiting to think more critically when you do practice questions, you're waiting too late. You start right now when you're reviewing the content. Okay, what would the exam want me to know about this? Right? And I went over this yesterday. So watch that video if you missed the video teaching I went over yesterday. So that's the thing about the test. That's why they increase the set of questions. Or let me say it like this. That's why they changed the format of the set of questions. Because before, what it was with set of questions, it was okay, it was like 2 or more you can get correct, right? It could be 2 or more that could be correct, and that was about it. But now they changed it as of last year, where it can be just one choice only, and it can be 2 or more, or it can be everything. So you could get a question that says which of the following whatever, and it's like A, B, C, D, E, F, and the answer can be just E. The answer can be just F, or the answer could be all of them, or the answer could be 2 out of 3 of them, or whatever. Or sorry, 2 out of in that situation 6 of them. All right, so that's one of the things as well. So the reason why they did that is because it's not really because the exam is evil. All right, you have to get that out of your notion. You have to not think that way. If you think, oh, the exam is evil, it's so hard, then it will always be hard. But if you change your focus where you're thinking, let me think more like a nurse. How would the nurse see this? If you start to think more like that, right, and you start to look at the content differently, you're not going to be afraid of the test. Because you're in alignment with how it thinks. Did you see that? Because you're in alignment how it thinks. You separate yourself when you think that it's so hard and it's so difficult, but you have to change how you think. Okay? So the thing about it is that SATA questions is testing you on how well you understand content. That's why they changed the format. Let's say, for example, if I had a patient if I had a patient and this patient, I gave them insulin. Actually, let me say it like this. Let's say I had a patient and they have a history of type 2 diabetes, right? And so I go into assess them, and I notice that they're lethargic. Like, let me give a fuller scenario. Let's say it was 7 o'clock, right? 7 o'clock, they ate breakfast. All right, which is great. And I gave them let's say I gave them 8 units of insulin, of regular insulin. All right, I gave them 8 units of regular insulin, right? And they ate breakfast, and I saw that they were going to eat breakfast. I saw them eat breakfast, but I come back into the room, and I look at the table, and I see that maybe they ate like half of their meal, and then when I talk to them, they're like lethargic. Right? They're more lethargic, and they're not really responding to me like the same way they were responding to me before. Which of the following could I do? Is it going to be A, give them another 10 units of Humulin R, B, check their blood sugar, C, give them orange juice, D, call the doctor, E, let's see, check their skin. If I was to pick all the answers, right? If I added one of those choices in real life where I did give them insulin and I did the other stuff, I would kill the patient. if I gave them more insulin, right? So if I also chose, yes, give another 10 units and also give orange juice and also check the sugar, that would kill the patient. That's the reason why they use static questions, because they're trying to see if you're safe. So if you can't identify that is not appropriate to do, then yes, that's why it will seem hard. Do you see that? Does that make sense to everybody? Comment below really quickly and let me know, yes, I understand. That's the reason why that's the thing about the exam. When it comes to the choices, it's not so much. The reason why it's saying that is that, yes, check the sugar, do everything. The reason why it's saying that because if you do more than one of those, you could kill the patient. That's the reason why it uses static questions. So the thing I want to stress is don't focus so much on the questions. Don't focus so much on that's why I tell people your preparation shouldn't be all about Nclex questions. Yes, that's part of it. But if you focus on questions only, you're creating holes in your studying. Your focus should be, okay, let me really understand type 2 diabetes versus type 1 diabetes. Let me really understand DKA. Let me really understand, HHNS. Let me really understand shock and why I would respond that way when the patient is crashing. That's where you want to be. But what a lot of people, they focus more so on, let me just do as much as I can. Let me just learn as much as I can. But they don't really focus on, well, what would really happen? So when you're looking at content, make it a focus. I want to understand this. I want to understand this. Let me tell you, I'm going to share with you right now. I remember when I was in nursing school and I struggled with med surg. I'm going to tell you the truth. I struggled so much with med surg. I hated med surg at that time. I was like, this is so hard. That's how I really felt. This is really hard, because the thing about nursing, it's like learning another language, isn't it? It's like learning another language. So I really struggled a lot with med surg, but it's something where honestly you get better at it the more you learn about it. That's why you have to put aside a social life and TV, and you need to focus on learning med surg. What I did personally is that I started reading more books on med surg and started watching more videos on med surg, and that got me. And eventually I understood med surg. I didn't realize how much I need to invest in time towards med surg in order to do well in nursing school and in the Nclex. And I know, and I thank God to this day, because I know that I need to get better at med surg, so that way I could pass my exam the first time. That way I could do well clinically the first time. So that's honestly what it is. So make it a priority to understand, not a priority to just consume, to memorize everything. Make it a priority to really, really understand. Okay, that's number 2. All right, here's number 3. And like I said, we are going to go over all of this and more in the challenge. All right, in the challenge, we're going to go over so much. It's going to be amazing. And like I said, you're also going to receive lesson plans, like daily lesson plans. So every single morning, or every evening, I'm going to email you the lesson plan for the next day. And then you're also going to receive a study plan tracker to track how many times you study that day, each day of the week. And you're also going to receive as well the agenda, so you know what we're covering every single day of the challenge. All right. So if you have not joined the challenge, even if you're on the email list, you have to be a part of the challenge email list. Otherwise, you're not going to get any of the free guides or anything. So to join the challenge, just type one word, Nclex. Nclex in the comments to join the challenge. It's all free, and we're also giving away a $100 giveaway as well. So to join the challenge, type one word, Nclex, or go to the pinned comment. It's all sent out via email. Yeah, I sent it out this morning to those that are in it, that joined already this morning. If you're joining now, don't worry, you'll get it tomorrow. All right, if you join today, you'll get it tomorrow. Everything will be sent out via email. And then you join the group too, because I sent a couple of the guides in the group for the challenge. So when you as soon as you join the challenge, check your email immediately, so that way you can confirm that you joined, and then you'll get the email with all the instructions. All right, which will tell you all this. Just type only the word Nclex only. Don't put RN in front of it or anything else. Just one word only, Nclex. Or go to the link in the comments. Okay, is this good? Is this good? Tell me if this is good so far. If this is helping you, if this is eye-opening, if this is encourage you, or anything of that nature. If you find this helpful, let me know right now. Yes, this is good. This is helpful. Share this video too. Like this video. Heart up this video. Let other people know about it. Thank you for tagging the video and thank you so much for sharing the video, so that way other people can receive this same information. It's really, really gonna help a lot of people. All right, here's the last one, and I'm gonna be done. This one I would say is the most important. Okay, I would say this one is the most important. It's great. Thank you, Mary. All right, this one is the most important. This one is the most important. This one is the most important. Okay, this one is the most important. This one can really change a lot of stuff. If you hear what I'm going to tell you right now, oh my goodness, you're going to be so glad that you were on this broadcast today. All right, you're going to be so glad that you watched this today. Okay, good. It's helpful. Okay, good. It's good. Okay, wonderful. Okay, so here it is. All right, this is number 3. For those that took your exam last year, right? And this may not be for everybody, because you did because the test is computer adaptive. So this may not apply to everybody, but I know it applies to a good chunk of people that took the test last year and may or may not have passed last year. When you took the test last year, did it not seem like you got a lot of management of care terms? Right? You got you saw a lot of stuff related to management of care, like case management, just random terms, maybe it's like stuff about bioterrorism, how to what's another word? Discharge planning, emergency discharge planning. What else is on there? So just a lot of management of care terms, right? So here's the thing that they have adapted, because remember, the exam is always adapting to the to the clinical field. All right, that's why they add this stuff. The third update, the third change is they're making it where there's more management of care issues on the test. If you're already familiar with the test, the management of care for the RN, which is called coordinated care for the LPN exam, this covers usually about 20% of the test. All right. It covers about 20% of the NCLEX exam. So specifically, there's a more emphasis going to be on things related to like culture competency issues, and like spirituality, and just like those specific topics you're going to see more of on the test. So culture issues, like that's why. So you need to understand different types of cultures. Culture competency, that kind of stuff, and then also just more spirituality topics, and then just being more familiar with just more management care terms. Okay, so it's not just only prioritization, but understanding, okay, for example, there are patients that are from a specific religion where there's certain things that they do or do not accept or tolerate when they're in the hospital that you need to be aware of. The reason why, and it makes sense that the exam is putting more of this, because healthcare is changing. Have you noticed? Healthcare is definitely changing, and there's definitely a greater diversity of when it comes to patients in the hospital. So for that reason, they need you to be able to, be sensitive to certain types of cultures, right? Yeah, like blood transfusions. You need to be more sensitive to certain types of cultures. So learning more culture competency is important. All right, is important. when it comes to and spirituality, yes, absolutely, is important. So it's not really hard when you think about that. That's not a hard issue. It's just being aware of it. It's just being aware of it. There's a book I recommend. I'll post it inside of the Facebook group. It's really long though. It's really long though, but it's fairly thick. But there's a book that I recommend that goes over different types of cultures and that kind of stuff. All right, I'll post it in the private Facebook group. If you're not part of the Facebook group, just when you join the challenge, you'll get the link to join the Facebook group via email. All right, if you have not joined the challenge, you'll get the link to join the challenge via email, or the group. So more culture stuff. All right, so just try and learn. Let me give an example. I remember when I had, and then I'll be done here. I remember I had a patient. Good morning. I had a patient who suffered from a really traumatic car accident. All right, really bad car accident, and he was wearing as well. Oh, I do. That's right. Oh, thank you, Mary. Okay, yeah. So I did put. I was trying to remember if I did add that on there. I have culture topics on the 70 diseases cheat sheet. Thank you for reminding me, Mary. I totally forgot. So if you want to get the cheat sheet bundle, it includes that on there. The link is right here. I'll just put the link in here. Again, I forgot what it. Man, I have to put it like this. This is easier, because it takes longer to write it out. But yeah, I'll put it. I forgot it's in the bundle. Thank you for reminding me. All right, if you missed the bundle, if you still want to get the bundle, it's included in there, and then just use the code New Year, and it's normally $39. If you use the code New Year, it'll be $29. All right, so just use this code right here, New Year. I'll pin this one right here. Okay, all right. So so anyways though, yeah, and then what I'm gonna probably be doing too, I'll be talking about culture some more because of this, because of that reason. So follow this page closely if you're not already, and join the challenge as well if you're not already. All right, so so that's the biggest thing. So that's not hard. Okay, yeah, so there we go. I remember right now. I had a patient, and this patient, he was an Asian patient. All right, he was Asian, and he suffered from a really traumatic car accident, really bad car accident, and he was wearing a halo. He had a halo vest and everything, and he was in a lot of pain, but he didn't take any of the pain medication. He refused pain medication. Thank you so much. He refused pain medication. And so here's the thing. Usually patients that are like Asian patients, they have a higher tolerance of pain, and they don't really like taking a lot of pain medication. That's an example of culture competency. Imagine if I was like, because I wasn't sensitive to their culture, if I was like pushing, no, you have to take it. No, what's wrong with you, right? Right? Like, although I think they should take it, but it's not up to me to decide that for them. So these are some examples of what I mean by culture competency. So it's not hard, just being aware of it. You see that? So it's kind of like when you have an inside scoop of stuff, you have an advantage, and then now you're not as blindsided when you take the test, because you know ahead of time what's going to be on it. Have you ever been in college or even in high school, or just younger and stuff, and the teacher allowed you to have a free index card? I remember I had a teacher that was wonderful like that, and they told you you can have one index card. You can have one index card, and it can be you can write whatever you want to write on that one index card. I love that. And like he told you ahead of time what was going to be on the text. So here's the thing about passing the exam. The more you know what's going to be on it, the better you're going to do. So don't focus on it's so hard to think critically, it's so hard, it's so difficult. No. Don't think about that. Just learn what's going to be on it. You see that? Just learn what's going to be on it. You know that spiritual and culture book? Yeah. What I may do, I may work on writing a book like that includes like a really like thick book on like that. All right. So anyway, That's the biggest thing. Don't feel like, like this is so scary. No, just learn what's on the test. You know, that's why I tell people go to the NCSBN website and download their test plan. It's on their site. And there's an RN test plan and there's an LPN test plan. Download the detailed one because the detailed one gives you a list of all the topics per category. Okay? All right, you guys. That was it. All right. I'm going to be back on tomorrow. Okay? Tomorrow, 9 a.m. is when the challenge is starting. If you're excited about the challenge, just go ahead and put an emoji in the comments. Put yes or put an emoji, one of the two. If you are excited, I know I'm excited. I'm like I've been so excited about this. If you're excited about this challenge, go ahead and put an emoji, put a yes, put whatever, so I know you're excited. If you have not yet joined the challenge, type one word Nclex in the comments, or go to if you just scroll up the banner of the Facebook page, I have the link to join the challenge there as well. bit.ly/choosing nursing challenge. The test plan, so go to ncsbn.org and then you go, and then it says Nclex. Click on Nclex, and then when you click on Nclex, it says detailed test plans. Click on that. All right, detailed test plans. Click on the RN one or the LPN one, whichever test you're taking. Detailed test plan for it. Right now they only have I believe they still have 2017 on there, or 2018 the last time I checked. That's gonna be 6 a.m. Pacific time. That's 6 a.m. Pacific time. You're excited? Hey, yes, we're excited. Yeah, the NCSBN website, that's where you download their plan. Amen. Your tissues are ready? Did you get some already? Mary, that's funny. What was I gonna say? Somebody said that was kind of funny. Oh, I love the emojis. Yeah, detailed test plan. Detailed test plan. Detailed test plan. All right. Join the challenge if you haven't already. Tell your friends to join the challenge too. Okay. Tell your friends to join. They're gonna miss it. Yeah, there'll be a replay. That's 6 a.m. If you're ready. but tell your friends to join the challenge. Right? They will love it. I'm telling you, it was so much fun. Central time is 8 a.m. Central time is 8 a.m. Pacific time is 6 a.m. But Eastern time is 9 a.m. ncsbn.org. ncsbn.org. And then like I said, to join the challenge, go to bit, put on here actually, .ly/choosing, or just type the word Nclex if you don't have Messenger. All right, or if you don't check your Messenger, you have to check your email right afterwards. Otherwise, you're not gonna get the what do you call it? The instructions. Okay. All right, so that's it, you guys. I'll see you tomorrow. I'm trying to think if there's anything else I want to mention. When you join as well, you're also going to get the handouts and the lesson plans. Join the Facebook group. Oh, thank you. I remember right now. Two things. All right, two things when you join the challenge. Number one, the first thing I want you to do is I want you to take, before we meet tomorrow, I want you to take the, if you have not taken it yet, I want you to take our free Nclex test. All right, to do this before we meet tomorrow. Okay, to do it today. If you have not taken it yet, go to freetest.choosingnursing.net. freetest.choosingnursing.net. Take it, and then we're going to go over that as well tomorrow. All right, based on how you did, and I'll talk about it based on how you did. freetest.choosingnursing.net. Take the test today, because tomorrow we're going to talk about a study plan. Okay, so take that test today, and I'm gonna go over it as well tomorrow. And then also, you guys, for those that pray for me. Okay, pray for me that I'll have the strength to really be on here and really help you guys, that kind of stuff. All right, and just really do my best to really help you guys. To join the challenge, go right here, type the word Nclex, all right? Type Nclex, or let me put on here. All right, let me put that. Type Nclex or go to the comments. Okay, go to the link in the comments. All right, and download your lesson plans. Download the lesson plans, download the study plan tracker, and join the Facebook group. Okay, New York City is East Coast, so 9 a.m. New York City is East Coast, so 9 a.m. All right, okay, you're welcome. You're welcome. Have a wonderful day. So go to the church service at 11 if your church is at 11. Go to the church service at 11 if you can, and join me at 9, and then we'll hop off. All right? Yes, free test. That's the link right there. Free test.choosingnursing.net. Take the test, okay? Thank you, Maria. Thank you so much. Okay, you guys. I'll see you tomorrow. Bye-bye.